The Rappahannock Area Community Services Board has been proudly serving our community for 40 years. We started in 1970 with a staff of 10 and grown to 30 facilities and more than 400 employees. Each year we provide services to 10,000 individuals with mental health and substance abuse concerns. We support another 1,500 individuals with intellectual disability and 500 infants and toddlers with developmental delays. Another 10,000 people take advantage of our prevention programs. RACSB has close relationships with a multitude of governmental agencies, area law enforcement, the school systems, nonprofit organizations, private providers, and area businesses. With such a strong and dedicated presence in the community, there is a good chance that you are already connected to RACSB. RACSB is the community.
Our dedicated staff of psychiatrists, mental health nurses, therapists, and case managers provides medication management, individual, group, and family therapy, as well as specialized counseling and case management services at each of our 5 outpatient clinics in Planning District 16. Intensive outpatient services for women recovering from alcohol or drug abuse is provided at a woman's place.
Individuals experiencing a mental health crisis can contact RACSB Emergency Services Therapists 24 hours a day, 365 days a year. We work closely with local area hospitals as well as area law enforcement to conduct mental health evaluations to determine the appropriate treatment setting for individuals in crisis.
Our expanded 12-bed crisis stabilization program at the Sunshine Lady House for Mental Health, Wellness, and Recovery is a community-based alternative to hospitalization with individuals experiencing a mental health crisis. We've created a warm and inviting home that provides the needed support to help individuals get back on the road to recovery quickly. The home was constructed through a generous $2 million grant from Doris, Buffett, and the Sunshine Lady Foundation. Many of the rooms were furnished with the support of local businesses, civic organizations, and individuals. It really is a home built with the support of the community and is a source of pride for our organization. Since moving to the 12-bed facility in November 2009, we've served 219 individuals. Since the program began in January 2007, we've served more than 800 area residents.
Well, there were 2 reasons. First of all, I saw the need for it. That was very obvious that there were not anywhere near the number of beds or the facilities necessary here in town, and I was alarmed and upset. And so the need was obvious. It was desperate. And then the second part, which came along right on the heels of the first, was I learned about Ron and the fine work that was being done by this organization. And that was thrilling because I didn't know what I'd get into there. So it was made in heaven. So it was even better. I mean, everything went so quickly and so well, and the finished product is so wonderful. I don't know, I'm very proud of it, very happy about it, very delighted that it could come to fruition. Makes me happy every time I think about it.
RACSB is partnering with the Fredericksburg Police Department to provide a secure drop-off site for individuals identified by area law enforcement as having a mental illness and who would benefit from this alternative to incarceration. The community benefits as responding officers can return to their patrols faster. Having officers on site also helps build relationships between the individuals residing in the program and law enforcement.
Well, there's a lot of different benefits for the crisis intervention team, but the biggest one is probably giving law enforcement the awareness of what mental illness is and how to best talk with somebody who is suffering from a mental illness and is in a crisis. That will help not only protect the community, but also protect the law enforcement officers and those who are in crisis. Because now all of the sides are beginning to understand each other a little bit better, and they can come together to help each other.
The grant from the Sunshine Lady Foundation also funded the renovation of 818 Lafayette Boulevard into an 8-room boarding house for adults with serious mental illness. RACSB supervised residential programs provide 24-hour supervision and assist individuals with gaining or regaining the skills necessary to live independently and successfully in the community near their family and friends.
Oh, this home is brand new. And we love it here, all of us. I cook and help them cook, and I like all the staff here. They're very good with us. They take care of us. It's a big change from being from Western State to here. From Western State, everything was done for you. At the Kenmore Club, I do the kitchen and the art group. This is wonderful. It's wonderful here. I'm glad to be home.
Kenmore Club, the local psychosocial rehabilitation day support program for adults with persistent and severe mental illness, helps individuals be active and succeed in the community. Club members enjoy recreational and volunteer activities as well as educational and employment opportunities. We support individuals in their recoveries with a focus on what they need to be happy and successful in the community.
Kenmore Club is important to me because it gives me somewhere to go every day, and it helps me to socialize and know how to interact with members here at the Kenmore Club, and we love each other. And it has helped me when I was sick to continue to have a place to go on. And here at Kenmore Club, I received my joys at the Kenmore Club. I love coming to Kenmore Club. It keeps me happy and it keeps me motivated.
For individuals with substance use disorder, RACSB case managers, therapists, and physicians work together to ensure individuals receive coordinated care, are linked to community resources, and educated about their problems associated with alcohol and other drugs to help get them and keep them on the road to recovery.
It is important to have community-based substance abuse program within our planning district so that we can address the needs of the population who are afflicted by addiction. Project Link is a program that comes under a Woman's Place, and the purpose of Project Link is to provide continuity and collaboration with other community resources to provide services to pregnant women or parenting women who have been impacted by substance abuse.
The Rappahannock Regional Drug Treatment Court is a collaboration between RACSB, the court system, local law enforcement, and government agencies. For individuals successfully completing the intensive program, charges against them are dismissed. RACSB developed a curriculum for the Juvenile Drug Treatment Court program to address co-occurring substance use and mental health disorders.
I was addicted to pain pills. I had been addicted to them for many years. I couldn't get off them, and what it took for me was, unfortunately, to get caught and to get in a bit of trouble. I thought that was going to be the end of my life as I knew it, but fortunately it wasn't. They put me in the drug court, and then I got services through the RACSB, and it was exactly what I needed. They helped me get off the drugs, stay off the drugs. I didn't lose my job or my family, which was such a miracle. I'm very grateful, for the services that I got there.
RACSB provides mental health services within the Rappahannock Juvenile Center and the Rappahannock Regional Jail. We provide crisis intervention, substance abuse services, diversion services, and case management. We provide psychiatric services to the inmates within the facility. This eliminates the need for transportation outside of the facility. We provide discharge planning for those with chronic and serious mental illness to assist them in the transition back to the community upon release.
In addition to a case manager based at the Micah Ecumenical Ministries Hospitality House in Fredericksburg, RACSB partnered with Micah to open a cold weather shelter for the chronic homeless at the Old Little Falls Schoolhouse. RACSB also provided assistance to open Micah's new respite home.
The mission of the Virginia Wounded Warrior Program is to provide the combat veterans with resources and services needed to transition from military life to civilian life. The support group here that we offer here in Fredericksburg and throughout the Region 1 area is kind of a unique group to provide a unique set of peer support, combat veteran talking to combat veteran, to try to get him to express what he's feeling and what issues that he has. Sometimes that a clinician might not be able to address that a combat veteran can, because there's an instant connection there, having been a combat veteran myself. Yeah.
Families are really the backbone of every military member. When it's all said and done, the family is all you have left. However, the families go through just as much as the member does during a deployment or a combat deployment. So it's very important to include them in the mix. They were there at the beginning of their career, and they're going to be there at the end.
Services for children and adolescents with serious emotional, behavioral, and other challenging conditions at RACSB include counseling and medical services provided by our psychiatrists and therapists, therapeutic foster care intensive in-home services whose goal is to reduce multiple foster home placements and keep children in the community instead of institutions.
The Therapeutic Day Treatment Program provides services in the classroom and works closely with participating Head Start, kindergarten, and elementary school teachers. We work with students to address social and communication skills, as well as anger management, impulse control, and personal care.
Help them along with that. Day support services for adults with intellectual disabilities are provided by Rappahannock Adult Activities. Activities for adults with intellectual disabilities are an important part of our community. Individuals are actively engaged in community activities such as bowling, volunteering, recycling, and other recreational programs. We provide a safe and fun environment for participants. Families can work and know their loved ones are supported successfully in their home community.
The group homes are places where the individuals can actually live in the community with their families and be in a natural environment.
I feel good living here. I like the room and the staff. Sometimes we play games outside. I help cut. I spread paper. Me and my roommates like to watch movies. I like it here.
In addition to the community group homes, RACSB also offers supported living arrangements that allow an individual to live in their housing of their own with staff providing support in their home. The Sponsored Placement Program matches individuals with foster families who provide room, board, and supervision while teaching independent living skills. RCSB operates 2 supervised apartment programs that offer a great level of independence for adults with intellectual disability.
Intellectual disability support coordinators help ensure the needs of each individual are assessed and the appropriate supports are in place for the individual to live successfully here in their home community. The RACSB Specialized Transportation makes day support programs accessible to participants residing throughout the region. Our fleet of nearly 60 vehicles travels more than 600,000 miles each year.
Early intervention services are provided by the Parent Education Infant Development Program. For the past 30 years, we have been working with infants and toddlers with developmental delays and their families. Supports and services are provided by a team of early intervention specialists to minimize delays, help children participate more fully in family and community activities, and provide multiple opportunities to lead successful lives.
RACSB prevention programs work directly with youth and their families to educate them about healthy choices as well as improved communication, decision-making, and problem-solving skills. RACSB partners with area preschools, community groups, and the public school system to provide these programs. The goal for the Dare to Be You, Second Step, and Too Good for Drugs programs is to give participants the tools to be successful in school and throughout their lives. The program for teen parents provides school-based education for pregnant and parenting teenagers in Spotsylvania County. Healthy Families Rappahannock Area provides support to at-risk first-time parents with free home visitations. Their goal is to reduce child maltreatment and increase school readiness. Rappahannock Area Kids on the Block uses puppetry to teach children and teens about important social issues. Kids on the Block create awareness and understanding in our community for people with differences and provide educational information on important health and safety concerns, such as childhood obesity and bullying.
Our commitment to the community is strong. We saw the need and expanded the crisis stabilization program at the Sunshine Lady House for mental health, wellness, and recovery. We are excited about the growth of the Rappahannock Area Crisis Intervention Team and the expansion of services to veterans and their families. We look forward to opening a new group home for adults with intellectual disability and a permanent home for Rappahannock Adult Activities in Spotsylvania County. The Rappahannock Area Community Services Board believes in community-based services. RACSB believes all people have the right to participate in the life of the community, the life of their choosing. We believe the community benefits from having these services available locally.
RACSB is the community.
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 RACSB is the community.